Hey guys, hello everybody, welcome back to my YouTube channel. If you're new here, my name is Lesoro Mothapo and I'm currently a 5th year medical student at Wits, and yeah, I'm on a journey to becoming Dr. Mothapo. So yeah guys, I hope that you guys have been well, that you guys are staying afloat, that you're still achieving those goals. I know it's end of year now and things are getting a bit like shaky and stuff, you know. I'm also just here trying to stay afloat, trying to do my best and making sure that I get through this academic year, because child, like, it's a lot. But yeah, I hope that you guys have been well, hey. And yeah, as you guys know, I was doing my obstetrics and gynecology rotation, and today I want to talk about my gynae rotation, and basically tell you guys about my first MVA. So what an MVA it's basically stands for Manual Vacuum Aspiration, and what that is basically a procedure that you do to remove any products of conception that remain in the uterus. So in simple terms, so let's say a lady has had a miscarriage or she's requesting to have a termination of her pregnancy. You basically do a procedure to sort of help clean up the womb, whatever's left behind after she's lost the baby, maybe in the first trimester. If she's lost the baby, or we've given her something to help with the termination, then you help clean what's left behind. So that's essentially what an MVA, or manual vacuum aspiration, is. I must say that this was not my most pleasant procedure to do. I really didn't enjoy doing it as such. It really wasn't something that I'm like, yay, I get to do it, right? So essentially, the first I remember when I was on call. So when you do them when we're on call, I was on call, and I was just like going about my call, nothing hectic, talking to another interns. And then she was like, hey, I'm doing an MVA, do you want to come? And I was like, yeah, sure. Like, I'm like, oh my gosh, this intern's actually calling me to come like see stuff. So like, yeah, I'm coming. And I was actually shook. I don't know, for some, I didn't expect it. I hadn't necessarily like watched videos or anything to sort of prepare myself for what an MVA actually is and what you actually do. So when I got there, I was shook. I was honestly shook. I was shaken. I was not okay. I was just like, no, 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 no. Like, I literally was just like, I can't. I literally cannot. Like, if you had me on your WhatsApp, and people had me on WhatsApp, saw that I was just not having the greatest of time. My statuses are just like, I can't believe this is happening. This is so painful. It looks painful, but actually it really did. And I think for me, what also made it a bit like emotional and not the nicest experience to have was the fact that the lady was just in so much pain. She was very uncomfortable. She was crying, you know. So it wasn't the nicest first experience, like watching it, and I was low key like traumatized after that, because I just wasn't prepared. And I feel like preparation is very important for any procedure that you're going to do, irrespective of how invasive or non-invasive it's going to be. Just knowing what to expect, what you're going to see, or what you're going to do actually helps a lot. So for me, I literally had no idea what to expect. I just went in. I was just like, boom, going in. And when I saw, I was just like, no. So anyway, so I observed a couple more after that, a couple more after that, a couple more after that. I was still very uncomfortable with it, and it still wasn't for me. I was still like, no, this is not it at all. So fine. After that, I basically said to one of the interns, I was like, you know what? When an opportunity comes to do another one, I actually want to do it, because I figured that it's important for me to know how to do it. It's a skill that I have to acquire, even though it's not something that I like. It's not something that I am jumping to do it and jumping to have a go at it. It's actually something that I have to know how to do, you know. And I want to rest assured knowing that whatever happens, even though I might not like it, even though it's not for me, it's not my cup of tea, I at least know how to do it. I have the skill. So then there was one patient where I actually had to do an MVA on her, and yeah, so this is basically about my experience doing that. And yeah, so anyway, with my first MVA, there was a lady who came in. She came in because she was bleeding and stuff, and what happened was that she was bleeding. She'd been bleeding a lot. She was having clots and stuff like that coming out. And then they did a pregnancy test. It turns out that she was actually pregnant and was currently having a miscarriage. So obviously they did like an ultrasound and stuff like that, and they realized that she was still having a miscarriage. However, not everything that was still in the womb had come out yet, you know. So then they gave her some stuff to help her, and over time when we checked again, not everything was out, and this was an indication now an indication for us to actually do an MVA, or manual vacuum aspiration, right? And so now they gave us some medication and stuff. They gave her like some medication to help with the pain and all of that and all of that. And then it was time to do an MBA. So that's when I volunteered to actually do it. I asked the intern if I could do the MBA. And yeah, so I mean, initially, I was thinking about the fact that it wasn't a very comfortable procedure and stuff. I was just talking the lady through it, sort of like letting her know what I'm gonna do, how it's gonna be. Because again, I feel like for me, when you're prepared, when they've told you what's gonna happen, when you've seen what's gonna happen, when you have an idea of what's gonna happen, it sort of somehow helps. I don't know. I just hope that that was helping for that lady, because I explained to her what I'm gonna do, how it's gonna be, like the whole process that might take this plus minus this long, you know, that whole thing. And then as we're doing it, I was like, like bleh. And then as I was doing the stuff, I'd keep telling the lady what I'm doing. Like, okay, now I'm going to be doing this. Okay, mama, now I'm doing this, right? So essentially what you do when you do an MVA, so initially the lady has to lie on her back. So you do it in a separate room. There's like a separate room when you do MVAs. The lady lies on her back, right, with her legs sort of like propped up on these things that you'll find on the side of the bed. So she puts her legs down like that, just opening so you can see the area, like the vaginal sort of area. And then what happens there, you take your swab and then you clean, right? Because obviously she's bleeding and stuff, so there's obviously blood or whatever that's on the outside. So you just clean. And then after that, you have to insert a speculum. So you insert a speculum into the vagina, and then you open the speculum to sort of help you visualize the cervix, or rather the mouth of the womb, right? Let's say the cervix is like the mouth of the womb. So a speculum will help you visualize it. And when you're in there, you sort of have to visualize the cervix, right? Now, we visualize sometimes when you're in there, you can't see it properly, and you need to actually see it properly so that you can see the size of the equipment that you're going to use to actually do the vacuum aspiration, because how open it is determines the size of the equipment that you can use. So if you can't see properly, you take again a swab and then you just clean the area, just so you can see the size. And then what happens after that is that you're going to estimate the size of like the cannula that you're going to use, depending on the size of the cervix and how open it is. I'm going to show you guys just like a quick demo, like how, like essentially I'm trying to say. I hope you guys so far are following with me. So let's pretend that this is the womb, this is the uterus, right? And this is the mouth of the womb, right? So essentially what happens is that this would be the cervix, right? So this is the opening or the mouth of the womb, and you're looking to see how open it is. And how open it is tells you the size of the cannula that you have to use, because you have to put something in there that is going to fit properly, not too big, not too small. So when you create like sort of a negative pressure, it's going to pull everything that's in there, it's going to come out. So then, say that this is your straw, you see the size fits properly in there. So when you create a vacuum, the stuff is going to come out of there. So yeah, so that's what I did. So I looked at the size and I fit it in there. So okay, this is a bit big. Okay, put in a smaller size. Great. And then after that, so I was just walking the lady through everything. Okay, I'm gonna start pulling, like I'm inserting the speculum thing. I'm inserting the equipment. I'm putting it in there, aspirating, cleaning up like some of the blood clots that come out. Clean up again, aspirating. Blood clots come out. It took quite a while. She was in like quite a bit of pain and stuff. But obviously, I'd like to tell her like, I'm so sorry. We're almost done. I know this is uncomfortable. And just like I thought the situation, the empathy that it deserves, you know, it's not something that's lovely. This lady had been trying to conceive for a while, and now she conceived, but she had a miscarriage, you know, so obviously that wasn't a pleasant thing for her, and this experience in itself was not pleasant. So then I just basically talked her through the whole thing. There was an intern there to help me as well, because she was a doctor who was supposed to be doing this, so she allowed me to do it and was there observing as I was doing it, helping me throughout the process as well. And yeah, man, eventually we managed to do everything, finish it up. And then yeah, essentially that's how the whole process went. You sort of clean her up afterwards, counsel the patient when to come back, medication that you're giving them. And I think for me, I remember speaking to one of my friends who's a doctor now, and she was basically counseling me, I guess, on doing such procedures, because as I said to you guys, I was a bit shaken and I wasn't okay after my like observing my first one. And she made me realize that for the most cases, when you do these invasive and not so pleasant procedures, we do them to help the patient. Because if you don't, in the case of an MVA, if you don't remove the stuff that's left behind, the lady can be prone to infections. She can get like all sorts of things happening to her, and eventually can lead to her own death. So by doing this, we're actually helping the lady. And it helped me realize that there are things that I like view as very uncomfortable, very weird. Like maybe if I'm doing like a digital rectal exam, that's not something that I wake up wanting to like, oh my gosh, I want to do, you know. But it's something that when you do that, it helps the patient. If you do a digital rectal exam, excuse me, you can know whether or not this man is prone to having cancer, or if his prostate is enlarged. You know, if you're doing it in a case where a lady has cervical cancer, you sort of see how far it has extended, has gotten to the rectal wall, you know, things like that. It's uncomfortable procedures that you do, but at the end of the day, they're all for the good of the patient, and you're doing it to help the patient. So I think that's the mindset that I took going into this, and it sort of helped me. And obviously in that moment I wasn't scared. I was very focused on what I'm doing, making sure that I don't inflict any more pain than what this procedure is. um I was very focused. I wasn't scared as such. I was just focusing on what I'm doing and learning the techniques and making sure that I get it right. Because as I said, in as much as this is not a procedure that I will be jumping at and raising my hand to do, it's something that I want to know how to do. It's a skill that I want to have and know that I can say, you know what, actually I can do this. So if push comes to shove somewhere, if I'm lost in some dodgy area and somebody needs to do it, I at least know how to do it. But yeah, guys, that's essentially what happened with my first MVA. I didn't necessarily do a termination of pregnancy. The lady had a miscarriage, so we had to do that. And yeah, I just wanted to share this with you guys. I know this is not the most exciting of stories. You know, a lot of women tend to go through this, and it's very heartbreaking. And even for me, as medical student or a future doctor, it's something that I find to be very sad. You know, I feel like for the longest time I was like, oh my gosh, why am I sad about this? Why is it like, oh, traumatizing and stuff? But I realized that I'm also just human, you know. There's certain things that'll make me sad, and it's okay for me to feel like that. I shouldn't invalidate how I feel about certain things, or things that we witness simply on the basis that I'm going to become a doctor, and I'm going to be seeing these things. You know, it's sad, and it deserves the empathy and the sympathy that that situation deserves. And it's okay for me to be sad about certain things or not feel comfortable about certain things. That's also okay. So yeah, I want to share with you guys this, the good and the bad that is in medicine, the things that are the highs and the lows, so that if you are looking to go into this, or you're coming to your clinical years, you know some of the things that you're going to be doing, or rather observing, you know. And you also have, I guess, there's some sort of preparation, because I just didn't know, and like I was a bit like, you know. But you guys will have at least some sort of idea of what's going to be happening, and you're going to see what it's all about. And yeah, and yeah, that's basically it. Hey, if this video is a trigger for anybody, I'm really, really, really sorry. I just want to share my experience in the hospital and the things that I've been able to do, things that I'm doing, the skills that I'm acquiring. And yeah, anyway guys, I hope that you guys have found this video to be informative, whether on a medical aspect or more an emotional, mental aspect. And yeah, I hope that you guys do subscribe, like, and leave a comment in this video. And yeah, man, until next time, let's keep the love going, let's keep the channel growing, and it's bye bye from me. Bye.